Hello students, good day to all of you, and this is Dr. BK for you, and in today's session I am going to talk about the cerebellum. So our learning objectives for today with respect to cerebellum will be a short introduction on the cerebellum. Followed by that we will be discussing about the situation external features, so that is the surfaces and other features which we can appreciate externally. Then followed by that we will discuss in detail about the subdivisions or classification of the cerebellum based on its function, and then internal structure. Okay, so the various layers in the cortex and the cells present in it we will be discussing. Then followed by the internal structure we will discuss about the afferent and efferent fibers, and most importantly the intracerebellar nuclei, then the neuronal circuit of the cerebellum, and then the afferent and efferent fibers. Then followed by that the peduncles of the cerebellum, then the blood supply, and finally we will actually conclude this session with the clinical aspects. Okay, now first coming to the cerebellum, so which you are able to see here in this picture is called as the little brain. So cerebellum corresponds to little brain in Latin. Okay, it is actually situated in the posterior cranial fossa. Okay, so anterior, middle, and posterior cranial fossa, the floor of the skull, below the tentorium cerebelli. So it is a dural fold. So that means it is present in the infratentorial compartment. Okay, and then it is actually a derivative of hindbrain vesicle, that is a rhombencephalon. So structures which are developed from the hindbrain are the pons, medulla, and the cerebellum. Pons, medulla, and the cerebellum. Okay, so the rhombencephalon can again be divided into metencephalon and myelencephalon. So the metencephalon is your pons and cerebellum, and the myelencephalon is your medulla oblongata. Okay, so situated posterior to the pons and medulla, and the cavity of the cerebellum is the fourth ventricle. So that cavity which you are able to see here is the fourth ventricle, which is present between the pons and medulla anteriorly, and then the cerebellum posteriorly. So the part of the roof, you're able to see that, so that is the roof of the fourth ventricle. So part of the roof also projects into the cerebellum. Okay, so then it is actually connected to the brain stem, mainly the midbrain, pons, and medulla, by three peduncles which you are able to see here. Okay, so from the midbrain to the superior cerebellar peduncle, then the massive middle cerebellar peduncle from the pons, and inferior cerebellar peduncle from the midbrain. So the most of the fibers entering and leaving the pons actually takes place through these peduncles. So thereby the fibers reach very distant and wide areas up to the cerebral cortex, and also low down towards the, or up to the spinal cord. Okay, so three peduncles connect the cerebellum with the brainstem, that is the midbrain, pons, and the medulla. So the mainly it is concerned with the maintenance of equilibrium, balance. Then second one is the maintenance of muscle tone, and the third one is the performing skillful muscle movements, skilled muscle movements. So for the skill to occur, there should be some what do you call adjustments needed in the muscle. So that information is actually given by the cerebellum, not directly but indirectly also. Okay, so mainly concerned with equilibrium, muscle tone, and formation of smooth coordination, especially the skilled movements, muscle. So with this short introduction, we will just pass on to the external features. So this is the superior surface of the cerebellum, which you are able to see here, and that is the inferior surface. When you look at the superior surface, what you are able to see here, it consists of two cerebellar hemispheres. Okay, this lateral mass is actually called as the cerebellar hemispheres. Okay, and in the midline you see a structure which is called as the vermis. So the vermis on the superior surface is not very distinguished or conspicuous. Okay, it lies in line with the cerebellar hemispheres, but on the inferior surface there is a depression between the two cerebellar hemispheres, which is called as the vallicula. Okay, so it is actually called as the vallicula, and in that you are able to see the vermis is situated in this depression, which is actually called as the vallicula. You are able to see that, and on the surface you are able to see numerous fissures, very extensive in case of the cerebellum. Even as compared to the cerebrum, it is very much extensive. So that is why if you look at the total surface of the cerebellum, it is much more extensive as it appears. So more than it appears, if you spread it, it almost occupies 50% of the cerebral hemisphere, 50% of the cerebrum. Okay, but it appears as if it is somewhat only 1/3 the size of cerebrum. Okay, so due to this extensive very numerous fissures, and you are able to see in between these folds. Okay, and that because of that only it appears very small, but the surface area is actually very much extensive. Okay, so numerous fissures you come across both on the superior and the inferior surface. The vermis is almost merging with the cerebral hemispheres on the superior aspect, but on the inferior aspect you can see it is actually present in a depression between the two cerebellar hemispheres called as the vallicula. Okay, vermis means it appears like a worm. So you are able to see worm with all those segments like an earthworm. So that is why it is actually called as the vermis. Then if you look at the two cerebral hemispheres, anteriorly in the midline you see a depression, and also posteriorly they are called as the anterior and posterior cerebellar notches. Anterior and posterior cerebellar notches. The fox cerebelli actually fits into this posterior cerebellar notch, the fox cerebelli. Okay, another dural fold. So that what happens, it prevents any mechanical injury to the cerebellum during various movements of the head. So continuing with the external features, you are able to see these between these fissures, these small folds of the cerebellum. Mainly they are the cortex. It is called as the folia. So folia means it is thrown into numerous folds. So if you cut a section of the cerebellum, inside these folia you can see they show a branching tree pattern. So like a branching tree pattern you are able to see that, and that is called as the arbor vitae. Okay, so if you cut a section perpendicular to these folia, these transverse folia, most of the transverse folia are transversely oriented. Just at right angles if you cut in the section, you are able to see the folia show branching pattern, which is actually called as the arbor vitae. Arbor means tree, so vitae means a living tree. Of course all trees are living things, but here in humans, so we call it as a branching tree pattern, that is called as the arbor vitae. Now coming to the fissures of the cerebellum, you are able to see three fissures. One fissure is the primary fissure, which you are able to see are also called as the fissura prima. So on the superior surface, you are able to see this fissure at the junction of anterior 2/3 and posterior 1/3. That is called as the primary fissure or fissura prima. Then, so that is the primary fissure you are able to see here. The next fissure, what you are able to see here is the primary fissure here. The next fissure is the horizontal fissure. Okay, so the horizontal fissure present at the junction of the superior surface and inferior surface. So not functionally important, this horizontal fissure. Only thing, it helps to demarcate the superior surface from the inferior surface is the horizontal fissure. Then one more fissure is there, which is actually called as the posterolateral fissure seen on the inferior surface. Posterolateral fissure seen on the inferior surface. This separates the posterior lobe from the flocculonodular lobe. Okay, so this fissure separates the posterior lobe. See, the posterior lobe, you have the anterior lobe and then the posterior lobe, also sometimes referred as the middle lobe. Posterior lobe sometimes referred as the middle lobe. So here you are able to see the primary fissure, and in front of it what you see is the anterior lobe. Okay, anterior lobe in front of the or anterior to the primary fissure. Then between the primary fissure and the posterolateral fissure you see the middle or posterior lobe, which is very much extensive. Then in front or anterior to the posterolateral fissure, you see a very small part of the cerebellum, which is called as the flocculonodular lobe. Okay, so that is called as the flocculonodular lobe. So if you carefully look at the structure of the cerebellum, you are able to see it is somewhat folded from above downwards. You are able to see it is somewhat a folded structure. So if you spread it, so it will look like two lateral masses, somewhat like a butterfly shape, where the wings of the butterfly, when it is spread, it will look like that, because actually the structures are continuous from above and below downwards. So that is the flocculonodular lobe. So three lobes of the cerebellum: anterior lobe, a large posterior or middle lobe which is present between the anterior fissure, and then the posterolateral fissure. On the inferior surface, anterior part of the inferior surface, you see the flocculonodular lobe. Flocculo or flocculus means flower like. So it is like a flower or appears like a flower. So that is why it is called as the flocculus. Flocculo, and this nodule is in the center, which is a part of the vermis. So it is called as the flocculonodular lobe. So as I told you, the vermis is actually worm-like, and it has got various subdivisions. And corresponding to these subdivisions, you also have a area of the cerebral hemisphere laterally that is also named according to it. So it is not necessary to memorize these names of the subdivisions of the vermis as well as these cerebral hemispheres, but anyway I will just mention the names. So from anterior, if you trace it, then you go below downwards. Anterior, you pass posteriorly, then you go to the inferior surface where the horizontal fissure is present. These are the subdivisions of the vermis. So lingula, central lobule, culmen, nuclei, folium, tuber, pyramid, uvula, and nodule. So and lingula does not have its corresponding area on the hemispheres. Okay, but central lobule, the lateral corresponding area on the hemisphere is the ala. Then you have anterior quadrangular, posterior quadrangular, superior semilunar, inferior semilunar. Okay, then you have the gracile lobule, biventral lobule, and the tonsil. Okay, so these are the corresponding areas of the cerebral hemispheres with respect to the subdivisions of the vermis. Okay, so you need not worry about all these names, or you need not memorize these names. So based on the function and phylogeny, the cerebellum is actually subdivided into three. The oldest part, the first formed evolved part of the cerebellum is your archicerebellum, the oldest evolved part of the cerebellum. So this is your flocculonodular lobe is a part of the archi or the primitive cerebellum, mainly concerned with your vestibular or equilibrium and posture. Okay, so vestibular in function. So this archicerebellum can also be called, the archicerebellum can also be called as the vestibular cerebellum. Then the next evolved is your paleocerebellum. So the paleocerebellum is mainly concerned with your muscle tone, maintenance of muscle tone, again posture and some crude movements of the limbs. So the parts corresponding to the paleocerebellum are your anterior lobe, that is in present in front of the primary fissure. Okay, corresponds to anterior lobe and pyramid and uvula. Pyramid and uvula. Apart from the anterior lobe, you have to also include this pyramid and uvula part of the vermis. So this is concerned with the paleocerebellum, that is a muscle tone. And the most newly evolved cerebellum, so which is very well developed in humans, and largest part of the cerebellum is the neocerebellum, corresponds to the posterior or middle lobe. So this whole thing you have to take it as the neocerebellum, but you should exclude the pyramid and uvula. Excluding the pyramid and uvula, the remaining part of the middle lobe is actually the neocerebellum, mainly responsible for the skilled muscle movements, because it is also called as the pontocerebellum. This is called as the pontocerebellum. Paleocerebellum is called as the spinocerebellum, whereas this is actually called as the pontocerebellum because the fibers from the pons, the transverse fibers, which actually receives which actually receives fibers from the cerebral cortex, passes and projects into this neocerebellum part. So skilled muscular movements is mainly responsible for me. Actually, the neocerebellum is mainly responsible for the skilled performance of skilled muscular movements, which has extensive connections with your cerebral cortex through the pons. That is why it is called as pontocerebellar fibers, neocerebellum. Okay, next actually coming to the internal structure of the cerebellum, if you look at the cerebellar cortex, it is mainly formed of three layers. So before that, it has got an outer gray matter, and you are able to see that, and inner core of white matter. So that is the inner core of the white matter and outer gray matter. And the cortex of cerebellum is actually homocortex. It is not of heterocortex, it is homocortex, which means it is uniform throughout the cerebellum. So you find the structure similar throughout the cerebellum. So mainly it is made up of three layers, MPG. So outer molecular layer, which you are able to see here. Then you have a middle Purkinje layer, which is not very clear in this picture. Okay, because it is very narrow thin layer only made up of a single layer of cells. Okay, then deep to that, the third deepest layer is actually the granular layer. So outer molecular, then you have a middle Purkinje cell layer. If you just look at carefully, you will be able to see some cells here, single layer, which is actually somewhat pink in color. So that is a single layer of Purkinje cells, and deeper to that you are able to see this is the granular layer with the lot of cells, the density of cells, and then this is your more deeper is your white matter. So outer gray matter and inner white matter. So the gray matter, the cerebellar cortex, is made up of three layers: molecular layer, Purkinje layer and inner granular layer. Okay, now let us try to understand the structure of the each and every layer. This is very important to understand the function of the cerebellum. Okay, so how the cerebellum works. So first coming to the molecular layer. So the molecular layer mainly consists of uh, two types of cells, that is the stellate cells and the basket cells. Okay, so mainly you come across these cells are actually called as the outer stellate cells, okay, and the basket cells. So you're able to see, so these are the basket cells and the stellate cells. Now apart from that, what else you come across in this molecular layer? So you are able to see the dendritic arborization of the Purkinje cells. So the Purkinje cells which is seen in the middle layer sends its dendrites. You're able to see that. So sends its dendrites to the molecular layer, also called as the plexiform layer. Okay, now if you look at it, the axons of this your basket cells and your stellate cells, they synapse with the Purkinje cells. Okay, so the axons of the basket cells and the stellate cells, they synapse with the Purkinje cells. They are inhibitory in nature. So if you look at most of the cells which secrete the neurotransmitter in case of the cerebellum is inhibitory neurotransmitter, which is GABA, gamma aminobutyric acid. So it is GABAergic fibers. Okay, so apart from that stellate cells, then you saw the basket cells, then you saw the dendrites of Purkinje cells. There are also fibers. So mainly you are able to see these fibers which are running parallel to the long axis. They are called as the parallel fibers. So they are axons of the granule cells. They enter the molecular layer and they divide into T-shaped fashion. So they are actually what is it called as the parallel fibers. So they anastomose with the again to the Purkinje cells. They are the excitatory fibers. Okay, so the parallel fibers excite the Purkinje cells. Okay, now apart from that, what other fibers you come across is the climbing fibers. Okay, so the climbing fibers you are able to see that. So they are also entering and making synapse with the Purkinje cells, dendrites near at the junction between the body and the dendrite. You are able to see that synapse mainly. So you see the axons of the climbing fibers, then you see the parallel fibers, then you see stellate and basket cells, and then you see the dendrites of the Purkinje cells. You're able to understand. So axons of the basket and the stellate cells, they actually synapse with the dendrites of the Purkinje cell. Dendrites of these stellate and basket cells, they will have connections with these parallel fibers and climbing fibers. Okay, so you're able to see that. So the parallel fibers and climbing fibers, okay, they will also have synapse. You're able to see one climbing fiber making a synapse with the dendrite of these stellate cell, same way the basket cells. Okay, so that is about the molecular layer. So next, passing on to the Purkinje layer, you are able to see a single row of flask shaped cells which are actually called as the Purkinje cells. So these Purkinje cells, mainly the dendrites, I told you they synapse with the axons of the stellate cells and the basket cells. That takes place in the molecular layer. The axons of the Purkinje cells enter into the deeper layers. That is, they pass on to the granular layer and enter the white matter, where they actually will relay in the intracerebellar nuclei. So there are four nucleus intracerebellar nuclei. You're able to understand. So the intracerebellar nuclei receives axons of the Purkinje cells. So the axons of the Purkinje cells are the only sole output from the cerebellum. So from this cortex, to be more precise, from the cortex, the fibers leaving from the cortex is mainly your Purkinje cells. So these Purkinje cells, what happens? They anastomose with the deep cerebellar nuclei, the axons. You are able to see that. So dendrites of these Purkinje cells are seen in the molecular layer, and they synapse with this parallel fibers, which you are able to see here, and climbing fibers. So you are able to see the climbing fibers. They also anastomose with this Purkinje cells. Okay, then so the cell bodies actually synapse with the dendrites of the basket and the stellate cells. This I have already explained to you. They are inhibitory. So they are inhibitory neurons. That is the basket and the stellate cells. Whereas the climbing fibers and your parallel fibers are mainly excitatory to the Purkinje cells. Purkinje cells in turn are inhibitory to the intracerebellar nuclei. Purkinje cells are in turn, what I told you is they are inhibitory to the intracerebellar nuclei. So I told you the axons of Purkinje cells enter the white matter and they relay in the intracerebellar nuclei where they are inhibitory. So except climbing and parallel fibers, other synapses are inhibitory to the Purkinje cells. Purkinje cell axons itself in turn are inhibitory to the intracerebellar nuclei. Okay, so now coming to the other deepest layer which you are able to see here is the granular layer. So granular layer, because it is actually populated with a lot of granule cells. So very small granule cells, numerous in number, you are able to see this, and along with the granular cells you are able to see some large cells which are not very much numerous. They are somewhat scantily populated, and they are called as the mainly your Golgi cells. So you are able to see the granule cells and then the Golgi cells. Okay, now let us try to understand the granular cells. The axons, you are able to see the axons of the granular cells. They mainly enter the molecular layer and then they divide into T-shaped branch, forming the parallel fibers. So you know what happens to the parallel fibers? They actually make synapse with the dendrites, mainly make synapse with the Purkinje cells and also with the dendrites of the your stellate and basket cells. Okay, and then they form parallel fibers which are excitatory to the Purkinje cells. That is one thing you are mainly able to see. Then the dendrites of the granule cells, they will anastomose with the mossy fibers. So you're able to see the mossy fibers. So the dendrites of the mossy fibers, they make synapse, sorry, the axons, that is the fibers entering the cerebellum, they are called as mossy fibers. Two types of fibers are there. One is the mossy fiber and other one is the climbing fiber. I will just tell you in a short while what is mossy and climbing fibers. So mossy fibers, they synapse with the dendrites of the granule cells. Again, they are excitatory to the granule cells, and granule cells in turn are excitatory to the Purkinje cells. Okay, so parallel fibers, dendrites of molecular cells, they synapse with the mossy fibers. And the next type of cells, large cells, are actually called as the Golgi cells. So the axons of the Golgi cells, the axons of the Golgi cells synapse again with the mossy fiber and take part in the glomerulus of the cerebellum. So I will come to what is glomerulus of the cerebellum. Okay, and the axons also synapse with the your granular cells. The dendrites enter the molecular layer. You are able to see the dendrites, they are entering into the molecular layer. So these are actually called as the Golgi cells. Okay, so the axons mainly take part in the formation of glomerulus, and dendrites, they enter into the molecular layer. Now what is a glomerulus? So you are able to see a structure of a glomerulus. The mossy fiber, once they enter the cerebellum and near the granule cells, what happens? They will form some bulgings. Okay, they will form some bulgings which are actually called as the rosette. They are actually called as the rosette. Terminal swelling is actually called as the rosette. These rosette snaps with the axons. The rosette actually snaps with the axons of the granule cells. Okay, so they actually synapse with the axons of Golgi cells and dendrites of the granule cells. So the dendrites of the granule cells, thereby what happens is get excited. These mossy fibers are excitatory to the granule cells. You are able to understand. So Golgi cells axons also synapse with this rosette, forming the Golgi apparatus. Okay. Again, Golgi cell is inhibitory to the granule cells. Okay. Because a feedback mechanism, Golgi cell, to its connection with the granule cell, gives a feedback mechanism to the granule cells. Okay. So the only excitatory component is the mossy fiber and the climbing fibers, and the axons arising from the granule cells are forming the parallel fibers are actually again excitatory to the Purkinje cells. Okay, so next moving on to the intracerebellar nuclei. So I told you the intracerebellar nuclei receives fibers of the Purkinje cells, axons of the Purkinje cells, and they are again inhibitory to the intracerebellar nuclei. Okay, so mainly four nucleus from lateral to medial you come across. The lateral most one, the largest nucleus is the dentate nucleus, most lateral and largest, like a crumpled bag with its mouth opening medially, more similar to inferior olivary nucleus. So this is the nucleus of neocerebellum, mainly concerned with the skilled muscle movements. The next nucleus which you see is the emboliform and the globose nucleus. So emboliform is oval in shape, medial to the dentate nucleus. They are concerned with muscle tone. So it is a nuclei of paleocerebellum. Same way, the globose nucleus also has the same function. It is somewhat round in shape. So since they have the same function and it is present between the dentate nucleus laterally and the fastigial nucleus medially, these two together are called as nucleus interpositus. Okay, emboliform and the globose nucleus, emboliform and the globose nucleus. So their fibers mainly output from this efferent fibers, they enter through the superior cerebellar peduncle. The next fastigial nucleus, you are able to see that medial most near to the midline. This is the nucleus of archicerebellum, because the fibers from the vestibular nucleus, your eighth cranial nerve, they actually come and relay directly, and they also, these fibers, they go directly to the cerebral cortex. Okay, so cerebellar cortex without relaying in this nuclei. Okay, so that is why the vestibular nucleus itself is considered as the displaced nucleus of the cerebellum. Vestibular nucleus behaves more like a cerebellar nuclei, even though it is seen in the brainstem. So four nuclei: dentate, emboliform, globose, and then what you have is the fastigial nucleus. Okay, next coming to the afferent fibers of the cerebellum. So the afferent fibers of the cerebellum are two types. So one is the mossy fiber and other one is the climbing fibers. So mossy fiber are mainly the afferents which enter the cerebellum from all the areas. Okay, from the spinal cord and also from your brainstem reticular formation, cerebral cortex, and also from your vestibular nucleus. Okay, so you have the vestibulocerebellar fibers, then you have the spinocerebellar fibers, cortico-pontocerebellar fibers. They form the mossy fibers, whereas What is the climbing fiber? So we have seen this mossy fiber only making connections with the granule cells, and from there the axons of the granule cells forming the parallel fibers. Whereas these climbing fibers are mainly from the inferior olivary nucleus. Okay, so the climbing fibers are nothing but the fibers from the inferior olivary nucleus. They are actually called as the climbing fibers. So coming to the mossy fibers, so fibers from the spinal cord, spinocerebellar fibers. So that is your dorsal and ventral spinocerebellar tracts. You are able to see that entering the cerebellum. Okay. Ventral spinocerebellar tract alone enters the cerebellum via the superior cerebellar peduncle, whereas this one enters via the inferior cerebellar peduncle, mainly your spinocerebellar and your cuneo-cerebellar tracts. So they are from the spinal cord. Okay, dorsal spinocerebellum and the cuneo-cerebellum, and your ventral spinocerebellum forms your spinocerebellar tracts. It's okay. So they are the mossy fibers. Apart from that, from the reticular formation, which is seen distributed throughout the length of the brain stem. They have nucleus, you have the raphe nucleus, the medial lateral nucleus. Okay, so reticular formation and fibers from the vestibular nucleus. Okay, fibers from the vestibular nucleus. So here you are able to see here from the vestibular nucleus, they end in the glomerulus. So all these climbing fibers, you are able to see mossy fibers. So that you are able to see from the reticular fibers, spinal fibers, which we have already seen. Okay, posterior and dorsal and ventral cuneo-cerebellar and the spinocerebellar tracts, spinocerebellar. These are all from the reticulocerebellar fibers. So they form your mossy fibers. They end in a rosette. The terminal endings form a rosette which synapse with the axons of the your Golgi cells and dendrites of your granular cells, and from there you are able to see they project into the cortex as parallel fibers. Climbing fibers mainly from the inferior olivary nucleus, especially from the opposite inferior olivary nucleus. So that is why it is shown on this side. You are able to see. So fibers, climbing fibers, you are able to see they actually form the olivo-cerebellar tract. They form the olivo-cerebellar tract, and these climbing fibers enter into the molecular layer. So from the vestibular nucleus, so you are able to see the vestibular fibers. They don't relay sometimes into the intracerebellar nuclei. They directly go to the your cerebellar cortex. Mainly they are going to the flocculo-nodular lobe. Okay, so that is your vestibular nucleus, and as I told you, it is a displaced part of the cerebellar nucleus. So the axons of the Golgi neurons, as I told you, form the parallel fibers which you have already seen. No, so that is mossy fibers. Through their after their synapse, their axons of the granular cells. So climbing fibers from opposite inferior olivary nucleus form the climbing fibers synapse directly with the Purkinje cells. So they don't take part in this glomerulus. Okay, and instead they actually directly. So that is why as I am again and again repeating these climbing fibers. Okay. So next, coming to the intracerebellar circuit. So how intracerebellar circuit takes place? A very simple explanation is climbing fibers and mossy fibers. So afferents, you are able to see here, they relay into the mainly how do they go into the deep nuclei? They are actually excitatory to the deep nuclei. So mainly all the fibers, what happens is they make connections with the granule cells. You are able to see they make connections with the granule cells, the mossy fiber. So these are actually the mossy fiber maintaining connection with the granule cells. From the granule cells, you are able to see the parallel fibers. So one is the parallel fiber which you are able to see. Other one is the climbing fiber, not making connection with the granule cells, directly going to the dendrites of the Purkinje cells making synapse. Whereas mossy, it is only synapse via the axons of the granule cells forming the parallel fibers. So these two you are able to understand. So that is why parallel is indirect mossy fibers. Now these mossy fibers you are able to see they are giving also collaterals which go to the deep nuclei. Same way the climbing fiber, they don't form perhaps the granule or form any Golgi apparatus, they directly go. Same way they also give collaterals to the deep nuclei. So that is one thing. So they both, climbing as well as the parallel fibers, excite the Purkinje cells. They excite the Purkinje cells. Okay. Whereas when they excite the stellate and the basket cells which you are able to see here, they inhibit, they are inhibitory to your Purkinje cells. Their axons actually synapse with the dendrites of the Purkinje cells. Then axons of the Purkinje cells, they relay in the deep nuclei. So only fibers coming out of the cerebellar cortex is these axons of the Purkinje cells. They are again inhibitory. So that is why minus sign is given. Where all you see inhibitory, it is minus. Where all you see excitatory. So here it is excitatory. Golgi apparatus. Mainly the climbing fiber and also your mossy fiber. They are excitatory. Okay. So and then what happens is collaterals from the climbing and mossy, as I told you, and the direct fibers from the vestibular excite the cerebellar nuclei. So what you are able to understand based on this is, so there is actually an excitatory and inhibitory mechanism which is mainly responsible for smooth coordination of the muscular activity. Smooth coordination of the muscular activity. So these in turn, the efferents leaving from the spinal cord, let us see how actually they influence this smooth coordination of the muscular activity. Yes. So now you are able to see the efferents of the cerebellum leaving the cerebellum. Mainly you see the fastigial vestibular pathway. So the fastigial vestibular pathway, you are able to see here fastigial nucleus. So to the vestibular nucleus they go to the brainstem. So from the fastigial nucleus to the vestibular nucleus is the fastigio-vestibular pathway. So from there to the ipsilateral neurons of the spinal cord via the vestibulospinal tract. So they influence the extensors. So mainly this is responsible for maintaining your posture, erect posture, okay, and the equilibrium, okay. So that is how they influence the motor neurons in the spinal cord through vestibulospinal tract. So from the fastigial nucleus to the vestibular nuclei. So you have medial and lateral vestibular nuclei. It is cut open for you to understand. So fibers arising from the vestibular nuclei from the vestibulospinal tract. Then you have also through the reticular formation. So these fibers also they take part in the reticular formation. Okay, so they are actually the reticular nuclei. So thereby also they influence your motor cells, ipsilateral motor neurons of the spinal cord. Then globose and emboliform nucleus. So you're able to see the globose and emboliform nucleus. So these globose and emboliform nucleus, they go to the opposite red nucleus. So you're able to see that. So they go to the opposite red nucleus, and thereby from the red nucleus to the spinal cord where the rubrospinal tract, they again influence the ipsilateral motor neurons of the spinal cord. Okay, then so ipsilateral motor neurons of the spinal cord. The next is your dentatorubral and dentatothalamic pathway. So this is your dentate nucleus. Okay, so all the nucleus receiving axons of the Purkinje cells. So fibers from the dentate nucleus, what happens? They form the dentatorubral pathway. You are able to see the dentatorubral pathway to the red nucleus. From dentate nucleus to the opposite red nucleus. So there is actually crossing over taking place in the superior cerebellar peduncles, fibers crossing, emboliform, fibers from emboliform and the dentate nucleus. You are able to see that. Okay, from the red nucleus, what happens is they go to the ventral nucleus of thalamus. From the red nucleus to the ventral nucleus of thalamus, so that is actually called as the dentatothalamic pathway. To the red nucleus they relay and also to the ventral nucleus of the thalamus. From the ventral nucleus of thalamus, it projects to the cortex. From the ventral nucleus of thalamus, it projects to the opposite cortex. Okay, so you are able to see everything has crossed, but how it influences the ipsilateral neuron is because fibers arising from the cortex, your corticospinal tract, again crosses in the pyramidal decussation. So thereby these fibers, when they cross here in the pyramidal decussation, they come again to the same side. Okay, so that is how the same side of cerebellum controls the ipsilateral motor neurons. So dentato-thalamic pathway. So fibers from cerebral cortex descend to the spinal cord and influence ipsilateral. So what is actually the information it is giving through this dentato-thalamic and also to the dentato-rubral pathway. So here you are able to see that is your dentato-thalamic pathway. Okay, and efferents. So mainly we have seen that vestigial pathway and globose emboliform pathway, dentato-rubral and dentato-thalamic pathway. So I'm just summarize the all these fibers which are entering superior cerebellar peduncle. So this is actually your superior cerebellar peduncle. So ventral spinothalamic tract, which we have seen. Then trigeminal nucleus is present here. So trigeminocerebellar and tectum of the midbrain. So tectocerebellar fibers all enter. So efferents which are coming out of the superior cerebellar peduncles, dentatorubral, dentatothalamic and reticular. So to the reticular formation, efferents. Middle cerebellar peduncle, mainly fibers from the pons, pontocerebellar, from the pontine nuclei. So pontocerebellar pathway. So okay, so cerebral cortex to the pons, pons to cerebellum via the pontocerebellar pathway. Inferior cerebellar peduncle mainly receives spinocerebellar, mainly your posterior spinocerebellar, cuniocerebellar, and from the opposite nucleus, olivary nucleus, then vestibulocerebellar. You are able to see vestibular nucleus, vestibulocerebellar and reticulocerebellar, afferent. Efferents, they form your fastigiovestibular and fastigio-reticular and cerebello-olivary fibers. Okay, so I have given mean afferent and efferent fibers of the each cerebellar peduncle. So arterial supply mainly by superior cerebellar artery and pica, and ica is the anterior inferior cerebellar arteries. Both are branches of the basilar artery, superior cerebellar and then your anterior inferior cerebellar. Posterior inferior cerebellar artery is actually a branch of vertebral artery. Okay, so supplies the posterior part of the inferior surface of the cerebellum, and you know posterior inferior cerebellar artery forms the lateral medullary syndrome. So coming to the cerebellar functions. So what are the cerebellar functions? Maintenance of equilibrium and posture. So this is how you know it maintains. Mainly through the vestibular apparatus, vestibular nuclei projects. Efferents from there to the mainly to the fastigio-vestibular pathway. You are able to see that, and mainly through your vestibulospinal pathway tracts. Then semi-automatic movements, maintenance of gait and posture. Okay, so when you walk, you swing your limbs, and all those things are actually associated movements. This is maintenance of gait and posture. Maintenance of muscle tone. All these I already enumerated in the beginning of this session. And skilled muscular movements. So let us see a bit detail about the skilled muscular movements. So mainly based on the inputs. So based on the inputs from the spinal cord, spinocerebellar, mainly bringing proprioception. Okay, then from the cerebrum, pontocerebellar is actually the proprioception. Okay, not proprioception, sorry, the intended muscle movement, what movement it is going to, which muscle it is going to move. So that is by the pontocerebellar, as I told you. The next one, proprioception and joint position from the spinocerebellar pathways. Okay, then the other input is from the vestibular apparatus, eyes and reticular formation. Okay, So the vestibular apparatus you are able to see, and from there, from the tectum, so movement of the eyes, and also through the reticular formation. So all this information is actually processed inside the cerebellum, and thereby through the efferent fibers mainly what happens is it gives uh, of course from the red nucleus, which I forgot. So you are able to see in the midbrain, you will see the red nucleus, and so the cerebellum influences the cerebellum indirectly by modifying the range, power, and accuracy of the movement. So what will be the range? What will be the power of the movement? How far it has to move? All those things. That is how the efferent fibers, which to the dentato-thalamic, dentato-rubral pathway, and through the reticular formation, it influences. Are you able to understand? So, and it also modifies the firing of alpha and gamma motor neurons. Alpha and gamma motor neurons. Okay, so that is also influenced by this cerebellum. So then cerebellum in learning, especially learning skilled motor activity and adjustments, is also influenced by the cerebellum. So mainly what happens in learning a new motor activity, the climbing fibers, so their firing actually increases or is increased during learning. So in learning a new motor skill, that is very very important. And also mossy fiber input to Purkinje cell is also modified, because slowly the learning shifts from your prefrontal cortex to the basal nuclei, and from there it comes to the cerebellum. Okay, so new motor. So if this climbing fiber olivocerebellar tract is actually lesion, or if it is cut, or there is any disturbances, then it is very difficult for the person to adjust in motor learning. So coming to the clinical aspects, any lesion to the cerebellum mainly due to vascular lesions, or any trauma, or might be due to any growth, tumors, medulloblastoma, leads to symptoms called as the cerebellar symptoms. So mainly ataxia, so loss of equilibrium. So the person will not be able to walk straight, he might sway this way and that way. And this is mainly, you can see your cerebellum is affected in alcoholics. Okay, so once you take alcohol, what happens is your equilibrium is lost. Then sensory ataxia is when the proprioceptive impulses from the spinal cord through the spinocerebellar tract is again damaged. It brings about sensory ataxia. So muscle sensation. Okay, so there is no deep tendon reflexes are all very much diminished. Then jerky muscle movements, no synergistic movement, jerky muscle movement, no coordination. You are able to understand when you want to touch your tip of the nose with your fingers, naturally what happens is the movement will not be coordinated. So your finger, instead of touching the nose, it might go this way and that way, and there will be a jerky movement, and unable to perform alternated repeated movements. So like when you use your screwdriver, so alternative, you see pronation and supination, so that will not be, you will be able to perform. You will have a condition called as dysdiadokinesia and dysarthria, inarticulation of speech. Okay, because the muscles moving the tongue, no, so to what extent it has to move in formation of the words, so all that is lost. And dysarthria. Nystagmus, oscillatory movement of the eyes. So the eyes keep on actually oscillating, jerky movements, and you won't be able to fix a gaze to a particular point or follow any object towards its direction of a movement. So that forms the nystagmus. Then, so each cerebellar hemisphere, as I told you, influence your ipsilateral muscles mainly through your ipsilateral motor neurons in the spinal cord. So hypotonia and intentional tremor. So as I told you, loss of muscle tone, loss of tendon reflex, and intentional tremors you will be able to see, because lesion in the dentate nucleus, especially on the affected side. And truncal ataxia, because flocculonodular lobe projects to both sides bilaterally. You see a truncal, your body actually what happens is swaying, not standing in the erect position. So truncal ataxia. Romberg sign is because even though the cerebellar lesions are minimal, he will be able to maintain the equilibrium based on the visual stimuli, because you will be able to see that whether he is walking in a straight line or not. Now when you ask the patient to close the eyes and then walk in a straight line, then you can see the cerebellar symptoms are more pronounced, and that is called as the Romberg's sign. So with this, I have completed the cerebellum, and thank you very much for your patient listening.